Hello and welcome to Teleislas News with the most relevant and important information of the day.
The Secretary of Health spoke to our cameras to inform about the red alert that is being experienced in the department due to an almost full occupation of the beds in the COVID ICU on the island.
The Secretary of Health spoke about the current emergency that is being experienced on the island due to the occupation of COVID ICU beds, which has been almost fully occupied. It is worth mentioning that although last week 4 beds were annexed to the COVID ICU, they are not being used due to the fact that 3 oxygen plants are at their maximum capacity, taking into account other emergency patients that were admitted over the weekend.
At this moment, we have an occupancy rate of 94%, which means that of the 17 beds we have available, we have only 1 bed left in the hospital to attend any person who arrives with severe respiratory symptoms. We are in a hospital emergency. We have a red alert, and the measures that we will apply according to the communique of April 19th will be to use the ID card schedule all day and curfew from 6 p.m. to 5 a.m.
On the other hand, the portfolio chief said that the possibility of referral to other Currew or urgent care centers in the country is being reviewed.
We are already working with the 2 EPS to review the possibility of referrals to other urgent care centers in the country, where patients who are not so compromised but who need hospitalization at this time are allowed.
Finally, the island health official clarified the rumor regarding the implementation of ethical triage in the departmental hospital.
There is also a rumor in different media that ethical triage has already begun to be implemented in the hospital. We want to inform that this has not yet happened, but it depends on the behavior of the community. If they present symptoms and do not isolate themselves and go out to contaminate others, our doctors will have to make that difficult decision of who should be connected to a ventilator and who should die.
And due to the red alert emergency in the COVID ICU unit, the departmental government informed that starting tomorrow, a curfew will be in effect from 6 p.m. The Secretary of Government, Abel Archibald, expanded on this information.
We have made the decision to change the curfew from tomorrow to 6 p.m. for residents and 8 p.m. for tourists, but the ID card schedule continues.
On the other hand, the official informed that people will be able to continue moving normally on the island.
People's mobility continues. There is no restriction of people's mobility, but the ID card schedule continues in the different establishments.
On Thursday, there will be a new PMU meeting where the conclusions of the follow-up of the application of the biosecurity protocols in the establishment in the coming days will be announced, in addition to the status of the percentage of occupancy of the ICU COVID on the island. This news agency will keep an eye on this information.
And the Secretary of Health provided clarifications regarding rumors of deaths in the COVID ICU unit due to power outages that occurred during the early morning hours. On the other hand, the head of the health office made a call for sanity in the face of acts of vandalism in the oxygen plant of the departmental hospital.
It is totally false. The person who died did it in the morning hours. When the power went out, there was a problem with the transfer of the electric plant that is working at the moment. But what happened was that it took a while for electric plant to come on, and it was solved. It is totally false that any person died because the power went out last night in the department.
On the other hand, the official expressed his dissatisfaction with a series of vandalism events that are occurring with the oxygen plant of the departmental hospital.
I make an urgent call to the community, and that is that criminal hands are vandalizing the oxygen plant. They are trying to loot it and have manipulated the keys that give the oxygen to the patients. The National Police are already aware of the case, and we hope that they are captures and prosecute these people who are threatening the lives of the patients who are hospitalized.
COVID-19 cases continue to increase on the islands. Today, the authorities reported a rise in the number of infections.
Today, the National Institute of Health reported 80 new cases of COVID-19 in the archipelago. Also in the report of deaths, the islands recorded death of a 62-year-old male. Therefore, the Secretariat of Health indicated that currently the intensive care unit for COVID-19 cases reached 94% of its, leaving only one bed available for care. It is expected that in the coming hours, the authorities of the island implement new measures to control the spread of the virus in the archipelago.
And today, the launching out of the immunization campaign against measles and rubella, which seeks to vaccinate 9,416 children, took place.
With 21 vaccination points, the Secretariat of Health of the department seeks to vaccine against measles and rubella to children between 1 and 11 years of age on the island. The vaccination campaign will last 2 months and will reach all institutions of San Andres.
The Secretariat of Health has been developing the vaccination campaign against measles and rubella. It is a campaign that is being carried out at the national level, and we are vaccinating the entire population from 1 to 10 years of age and all children who are turning 11 years since January 1st of this year, 2021, until July 31st of 2021. The idea is to apply an additional dose of these biologicals to each one to protect them and prevent outbreaks caused by this disease.
This day of vaccination will be held this week in different educational institutions and will aim to vaccinate 9,416 children. Currently, the Secretariat of Health has a schedule with 21 points of immunization.
We will do sessions from 8 a.m. to 2 p.m. The invitation is that all parents who have children within these ages attend the call and follow the directives of the schools so that children can receive their additional dose of measles, rubella, and to protect the children of the department.
In the coming days, the campaign will be extended to the municipality of Old Providence.
And in other news, aid continues to arrive for the families that were affected by the fire in the Big Pond sector. This time, they received school kits.
These school kits were donated by some tourists who are visiting our archipelago and were brought with help of the Colombian Air Force. In this way, the victims' children will be able to continue with their classes and also receive food and toys that little by little will help them to pass this moment of tragedy.
Today we brought groceries, clothes, shoes, school kits, and we wanted to bring them some of our help so that they feel well. This does not only depend on us, this depends on many friends and companies in Medellin and other countries like Chile, Canada, United States, and thousands of people who help us, and thanks to God, today through the Colombian Air Force and Lieutenant Andres Bello informed us about this house that today has to rise again from the ashes.
Let's remember that last Thursday, these families lost everything after a fire completely consumed their home. Nashira Nelson, the owner of the house, had arrived to San Andres after being victim of the Hurricane IOTA. However, today she's facing a new tragedy.